What is the knee deformity and how it starts?
Knee deformity means it is the deformity around the knee joint, and they will have bow legs or knock knees. These are the most common we can see.
What causes knee deformity in child or adulthood?
In child, it is most commonly due to the vitamin D deficiency. Most common thing is the osteoporosis due to the weakness of the bone.
The osteoporosis happen at which age?
In women after hysterectomy or after menopause. In men, the patient is a smoker, alcoholic. Osteoporosis is lack of the strength of the bone. That is, density of the bone decreases.
So how it differ from the deformity to the normal alignment?
If there is a gap, then it is in varus.
Okay. How you differentiate and distinguish a structural deformity and knee issues?
If it is a structural deformity, patient will have pain some months ago that is very small. That gradually increases. Best diagnostic tool is full-length X-ray. Full-length X-ray from hip to the ankle joint.
How successful our surgeries are and what are the recovery process? Sir, if a person comes to you and you find out that there is a problem on the knee, it's knee deformity or knee osteoarthritis, whatever may be. If there is any deformity in the knee, that affects the upper joint or lower joint?
It affects the both.
Both.
It preferably in knee joint. If the knee joint is in varus, your ankle go into the varus.
Okay.
Yes. As the hip is a sort of ball and socket joint, it effect on the hip is very minimal. It mostly affects the ankle joint, and if ankle is in varus, foot goes to the flat.
Flat feet. Okay. Valgus.
Valgus, you will have a genu var.
Yes.
What do you say? Opposite to the.
If it is lateral bundle is affected, then you will get the
flat foot. And foot is varus, you will have cavus. And the grade toe is opposite to the bunion will have something.
Yes. So, and hip joint?
Hip joint, as it is ball and socket joint, it doesn't have that big effect in the hip joint.
Okay.
And hip joint, if the hip joint is involved, knee joint will be involved.
Okay.
And due to that
limping.
Due to the limp, the way he walks.
Yes.
Yeah, and as the hip is, if the hip is involved, patient will have mostly in adduction position. So weight passes through the lateral aspect of the knee joint.
Yes. So better to check and better to visit to your doctor and check it yearly. And sir, I've seen many patients, those who comes and they do certain kind of athletic involvement. What are the athletic knee problems they face in athletic person, and how it affects their career? So
first thing is in the career means if patient is aiming for some army thing, bow legs as well as the knock knees they will get resected, and that is due to their inability to do all the activities what the normal people can do, and he will take rest saying that it is I am suffering from the knee pain. So that the reason they may reject them. But in the regular life, the simple thing is they can't perform the regular physical activity. They can't do at the end the pain increases. They can't do even their regular work. That may cause increase in weight and the increase in intake of NSAIDs. These both will affect internally and physically.
Sir, you just few times before you have discussed about conservative management. Sir, I have seen many patients those who are using osteoarthritis knee braces, OA knee braces, and along with modified footwears like some kind of wedges. So, do you recommend them that the patient, and what are the benefits?
In the early stages, your valgus offering knee brace as well as the lateral raising wedge, they both do work. Just because it's alignment issue.
Yes, alignment.
They make you straight, but they works well in early stages, grade 1, grade 2.
Yeah.
When it comes to the grade 3 and 4, then surgical intervention should be started.
Okay.
In early stage, it works wonderful. Even if the patient has severe varus, that's what I'm saying. If you give the valgus offloading knee brace, patient will feel the relaxation result of the surgery temporarily at least.
Yes. Is those patients who are not medically not fit for the surgeries, or they're due to some constraint they're not going for the surgeries. For them,
as well as the weight.
yes, weight also. For that case, this braces and footwear modification is important.
Yes.
Sir, sometimes when the patient start walking for few days, few months, few years, and it is one part of condyle is eradicated completely. On that case, patient didn't feel any kind of pain. That kind of patient comes to you.
Patient will come with pain. Without pain, patient come to doctor. Don't come to the doctor.
No. If they'll notice that their knee is getting some deformity, the angulation is changes, and while walking, they are getting some kind of initial the pain was there will be there, but when the patient starts using it after few years or few months, definitely that condyle part will get eroded. So on that condition, what you suggest to them?
So it is now or never. Like if patient comes to you at the earlier stages, like if he comes to me at 30s, if I can align that perfectly, he may come to me after some years, or he may not come back to me for the pain.
Okay.
If he delayed it, so some of the cartilage were eroded. So even if I align it at that time, so he will definitely come to me after some years. Means I am postponing the replacement. So replacement is, of course, is the final surgery. But for that, if I can align it, if the weight perfectly pass through the weight line, can perfectly pass through the center. If the medial side is eroded, I would like to keep that on the lateral. The weight line should be passed through the lateral side of the knee joint, where it is fresh and it's healthy. So the medial side will be offloaded, and patient will have a weight bearing on the lateral side, and medial side it may regenerate. It will regenerate.
Okay.
So the best age is whenever he notices it, whenever he know that it's time for the surgery. And most of the patients, I say it is their lack of knowledge. They don't know that it should be corrected. What they feel is it is normal in everyone.
Yes. Sir, as you have discussed a lot of particularly knee deformity topics,
Yes.
I just want to ask few things that I should know and the viewers should know about you also. Why do you think about orthopedic surgery? Why you keep interest on orthopedic surgery rather than other specialized?
Yeah, orthopedics is like if patient comes to you with any ailment, any issues, and you can change it or take it out somewhere in operation theater. The patient will feel happy, and we will feel happy by seeing the X-ray. Something we can do. I can't tell if I write some medication. You may like recently my hospital is multi-specialty hospital, where I have seen a case of dengue. Like my father has seen the patient with a case of dengue, and platelets is suffering from severe thrombocytopenia. His platelets are around 60,000. My father kept him on just IV fluids and oxygen medicines. And next, after 4 hours, the platelets has come to 40,000. Then we have continued the same medication. Next day morning, the platelets have been increased to 70,000. Then patient said, "Sir, he has consumed kiwi fruit, sir. He has consumed papaya, sir. That is the reason for the increase in platelets." So we can't take the credit when we have done other subspecialties, other non-surgical specialties. In surgical specialties, orthopedics, I can see most of the people suffering from many deformities. Deformity is the main reason for my interest in orthopedics, as well as the salvaging the limbs. If the limb can be salvaged in any sort of infections or any sort of deformities, a patient don't want that limb should not be a burden for the patient.
Yes.
So we can do something for that limbs, or we can do something for the patient well-being. So I feel orthopedics is the good branch to do that.
So till now, I think you have done many complex surgeries, knee surgeries. So what kind of surgeries that you have done till yet? Which is most important surgery you have done till yet, and how did you handle it?
One case, that is not a knee case, but it's one of that case taught me a lot. She is some inter-secondary student. She has an injury of run over by RTC bus.
Okay.
She has a very significant trauma. She don't has her lateral malleolus foot is deviated laterally, and she is in hospital for about 3 months. Then she got some wound cover. Skin grafting was done. Then one doctor called me for correction of the deformity. When I've corrected the deformity, foot is in equinus and varus. I've corrected the foot deformity. At the time of correction, and I've thought of me, as there is no lateral malus, I'm doing orthopedics. I fuse the joint, the ankle joint. Then at the time I've seen a small point of pus. I've sent it for culture sensitivity. As she is in a hospital for about 2 months, she has got a bug which doesn't respond to any antibiotic. There is no sensitivity for any antibiotic. I have done the test in 2 labs. She has become so close to my heart. She used to call me brother. And then the stress has increased. I asked them, please give me one chance. So she has complete trust on me. Her father and mother main lack of trust is due to the logistics. I told her, I'll try to help you from my side, and I want only 2 T's from you: trust and time. It may take some time, so keep trust on me.
Yes.
I have resected the bone, did the bone transport. About 16 centimeters bone was lengthened.
Okay.
Then fine, she will come to me. She will come to my hospital at least once in 2 months. So she's about 80 kilometers away from me. She will come to me. She's going to degree by walk, and she's one of the good cases. The main reason for the success, the trust of the patient.
Trust and time.
Trust and time.
So till today, you have done a lot of surgeries, knee surgeries. What advancement in knee surgeries excites you today, and how it excites you?
Yeah, I don't say that is advancement. I say it is a new wine in an old bottle. ITB osteotomy, it was started some years ago.
Okay.
This knee preservation surgery, but due to the advancements like replacement and all, maybe due to the lack of awareness by the patients, due to the lack of awareness about the deformities, patients have developed this osteoarthritis. And if you can preserve the native joint, and you can prolong the life of the native joint, and if the patient, as I've told you earlier, replacement is the best surgery if it was done only once. If you can make that happen, you can I think at least saving some knees is a very good thing in your life.
Yes.
So what I say is knee preservation surgery, like this high TB osteotomy, this works very well. So this excites me a lot. Like most of the patients come to your OPD with some difference in the gait due to the pain,
Yes.
Wide stepping gait and all. All those can be treated. Patient comes to you now, and he comes to after the surgery, and he comes to you after 2 months. You will feel happy, and your endorphins will be released by seeing the patient gait and the patient happiness face.
Yes.
So that makes me more excited.
That happens, sir, when the patient walks after your surgery, after your treatment, when the patient starts walking, and with their happiness only, you feel like happiness.
Yes.
Sir, till now we have discussed about all the knee deformities. Let's discuss about some important myth that few myths are there. Let's discuss one by one.
Sure.
So I'll ask the question about while I'll tell you the myth. You just tell me whether it is a myth or fact, and explain it. Knee deformities only affect elderly people. It's a myth or fact?
It is fact. As it starts in the childhood, it keeps on pressure on one part of the joint. So it affects at the time of your old age. It is chronic effect. Like if you have a stone in the rock in the sea, it becomes sand after repeated stress. Okay. The same way.
You are talking about osteoarthritis, right?
Osteoarthritis. The deformity lands in osteoarthritis. That is the end stage of the deformity.
Okay. Knee deformities are always caused by injuries. Myth or fact?
No, it's myth.
It's myth.
It's myth. It's not always caused due to the injuries. It is due to the metabolic issues like osteoporosis. It can be due to the tumors like exostosis at the joints, at the growth plate. It may be due to the growth plate injuries.
Okay.
That comes into the injury. That can be insult to the growth plate like infection.
Okay. But there may be chance of injuries leads to
deformity. Injuries will cause deformity. But I say injuries are not only cause of the deformities.
Okay. Sir, another question, another myth is that all the knee deformities required surgeries. Myth or fact?
It's fact. Deformities should be treated.
By the surgeries only?
At least, if it's to prevent, you can go with orthotics. But if they establish a deformity, and it should be corrected. If it can't be corrected by the orthotics, and how long can the patient use orthotics?
Yes.
In early years, he may feel low due to that. His colleagues or friends, he may bully him because while using this orthotics, and it is like regular shirt and pant. He can't making it as a habit is very difficult in early age group. If in old age patient, if it is established pain, if you want to postpone it, definitely you can use orthotics.
Sir, is there any kind of deformities or is there any kind of thing which improves in orthosis after using orthosis that can be healed or that problem will be solved?
Laxity, intraarticular issues like laxity, instability due to the ligaments,
ligament injuries,
that can be done with orthotics. Even as I've told, in grade 1, grade 2 osteoarthritis, and 19% of the footwear with plantar fasciitis and all. Where I say, when I write prescription, I will say the patient 30% of the pain will be taken by my paper, and the rest of the 70% will be by the footwear.
Myth number 4, sir. Once you have knee deformity, it will keep getting worse.
Yes, it always gets worse. As I've told you, the same example of car.
Yes.
If the car wheels are not aligned, they will get worse. To make them correct, you should do alignment.
Yes.
So if not, you can the other way, that is orthotics is, if you can drive the car in a safe way, you can postpone the alignment.
Yes.
But alignment should be done. If you can drive the car in a highway or smooth roads, you can postpone the wheel alignment. That is using orthotics. You can postpone the alignment.
Sir, myth number 5. Knee deformity only affects the knee.
No, it's myth. Knee deformity affects the joint above and joint below. But joint above, as it is the ball type of joint, the effect on it is very less. It will more affect on the ankle joint, where you can see the clear deformities. Yes. And one more thing is, the other way recently I have gone through is abductors. That if most of the people say for the knee pain, quadriceps and hamstring strengthening. One more thing is abductor strengthening. If you can strengthen your glutes strongly, it can prevent your ligamentous instability of the knee joint. Like your tensor fascia lata, it will pull the knee laterally, so it will correct it a little.
Sir, from your side, what you suggest to our viewers and the patients, those who are right now they are getting some kind of knee pain or just in the starting stage?
In early stages, I always advise them first early stages, try to I advise them to go for the strengthening of the both quadriceps, hamstrings as well as the glutes. That's the abductors. Strengthening is not a one-day process. If you start now, you will see the result after 3 weeks, minimum 3 weeks. Even if the pain worsens, and if you can see a deformity, please consult a doctor, and any doctor, and discuss with them. So most of the knee pains can be treated perfectly, whatever may be the way. There are many ways to be like it. You can follow the way. You can follow your doctor. But if the deformity is established, if you just discuss with your doctor about the alignment issue. If the alignment is done in a varus knees or middle compartment osteoarthritis knees, it is almost like he'll go back to his some of the years younger in the knee joint if it is alignment is correct.
Yes. Thank you, sir.
Thank you.
Today we have a great discussion regarding deformity. Hope next time we'll meet and we'll talk a little other topic also.
Sure.
And thank you, sir. Thank you for coming.